So I have the honor and the privilege of introducing Sara Chokshi. Dr. Chokshi is also with HITLAB, a director of research, and I am pleased to be able to introduce her as she leads our final panel around information and awareness gaps around contraception access and empowering women. Sara, so great to see you, and I will turn it over to you.
Super. Thanks, Lisa. Thanks so much. It's great to be here today. Thank you for that last discussion. It was really insightful. I'm looking forward to the to be continued of that as well. So thanks so much. So I'm here today with Natalie Principe and Carolyn Kay. Thank you both for joining me for this quick, but hopefully, I have no doubt, fruitful conversation. Today we're talking about information and awareness gaps when it comes to contraception and access for women. And so just to kind of kick it off, first, I'm going to say that, of course, in the past hour, they've decided to start testing the fire alarms in my building. So if I quickly go on mute, please forgive me, but hopefully we're all set. So just a heads up, but I have no doubt you can keep everything rolling. But hopefully that won't happen. But aside from that, as Lisa said, I'm the director of research here at HITLAB, and I'm here with two fantastic panelists. So I'd love to hear from you, Carolyn, and from you, Natalie, just a little bit about yourselves. Carolyn, can we start with you?
Yeah, you bet. Hi, everybody. Thank you so much for having me. I'm really happy to be here with you all. I'm an OBGYN by background and practiced for a number of years before training into a non-clinical role involving training of clinicians in reproductive care, as well as advising startups that are involved in contraceptive access. And I currently work with Roche, so my opinions to discuss today are my own and not necessarily those of my employer. Again, happy to be with you all.
Awesome. Thanks, Carolyn. Natalie, hey, thanks for joining us.
Great. Hello, everyone. So I'm Natalie Principe, and I am a board member of the HITLAB's Women's Health Tech Initiative. And I also run my own consulting firm called Extend Health Consultants. And I've been in the women's health care field for a number of years, and it's great to be here.
Super. Thanks, Natalie. Okay, so let's kick it off. I'm just going to start with a little bit of context about what's bringing us here today. So we met in preparation for our panel today to exchange some thoughts on what we thought would be most important to talk about with regard to contraception and digital health, particularly in light of our topic for today, bridging or taking data and turning it into information, and the gaps that can happen along the way, as well as I think an elephant in the room always these days when you talk about contraception, the recent Dobbs decision, and the latest thinking on what that means and might mean in the future for access to contraception for women, at least in the United States. So, as a group, we ended up with some key topics, a few thoughts, some answers, but mainly just, I think we were laughing, mainly lots and lots of questions, open questions, and an inkling that there's a lot of, dots to connect here in a complex and quickly shifting landscape. Those shifts are occurring in digital technology, as we just heard in the last panel, the way digital is being applied for family planning for sure, both on the patient and the provider experience side. And then there's also the social, political, legal shifts happening in the country and around the world, and it's really asking us, I think, particularly over these last 5 years, as these solutions have had pretty widespread adoption, and if you compare it to many other kinds of tools, now it's time to look deeply. What are the implications of using these tools and data to prevent pregnancy? So I say all this to say, with all that in mind, we ask you to feel free to fill up that Q&A box with your thoughts and your questions. We have, I think, about 10 minutes today, so not much time. I'm going to stop talking, but I really hope that, you know, what we come out with are lots of those questions that all of us public health people, as part of the symposium today, you know, start talking about, start digging into, start highlighting. So, you know, with that in mind, let's start with talking about data. We have an increasing number of platforms out there aimed at women's contraceptive needs. There's tools that offer users solutions for managing their fertility, including preventing pregnancy, tracking periods, basal body temperature, tracking that kind of thing. You know, this is an example of the data being collected and turned into information for users. So, you know, in addition to that, there are tools that we have that provide information on contraceptive choices. You know, something like the Lowdown is one I've, you know, read about recently. So they're not as much about using digital to track your own personal body data, but providing information on what are your contraceptive choices. So those, aside from those two, then there's those tools that, you know, either in tandem or aside from that, offer some sort of telemedicine counseling and access to these contraceptive technologies, like mail order consultation and mail order of contraceptive pills. So my question, and I'm going to throw it to you, Carolyn and Natalie, from now on, how should we be thinking about these solutions as valuable in filling that, you know, filling that gap, going from data to information? Natalie, thoughts?
Yeah, I mean, I'm just going to reiterate some of the things that you said, right? I mean, data is a powerful tool, right? Digital is a powerful tool and should be used in this space because you can reach more, you know, potential patients, and you can reach them, you know, with solid, knowledgeable information. But you know, a big data gap that exists, especially in the example where you talked about, you know, patients that can literally go online and receive, you know, the pill, birth control. That doesn't cover the other choices that are out there for a woman. And, you know, ultimately, you know, limits her knowledge. So, you know, there's things to figure out in terms of what, you know, what we can do about that. I think we're also in the age of empowerment for women. Obviously, we have some serious headwinds happening now, but I think the mentality that every patient owns their data is critical. And I don't think that digital in the health tech space is fully prepared for that. You know, if myself, I'm a patient and I just say, okay, I've been using a period tracker or anything else, menopause tracker, whatever the case. And I ask to have my data history. Is it going to be brought back to me? Is it transversing the internet? How secure is it, right? All of those things come up. And I don't think that security in these platforms, right? It's not all created equal. So those are, again, more questions and things to think about than maybe answering your question.
No, not at all. So,
Yeah.
you know, security, you know, and also one I hadn't thought about that much until you brought it up when we were talking initially, which is, I wonder how much digital coming into contraception has tilted what options women choose because it changes what they're exposed to. Carolyn, any thoughts?
Yeah, you know, as someone who is in practice and then continues to be involved in the digital space, I'm very interested in education. And, you know, absolutely to your point, Natalie, I think that information is a social determinant of health, right? So those who have access to good information are the most informed about how to make the best choices for themselves, health decisions for themselves. And when you don't have good information or you have a lack of information, you're not in such a great position. And so I think, and on the one hand, many of these things has really democratized this information and really gotten it out there to a wide variety of audiences, whether that's younger folks, whether that's folks in more rural areas. I think that has been really great. But on the other hand, I think that with everything that's happened politically, I think that we have maybe for a long time, or maybe I have, taken for granted, some of these apps and some of these data, tools that are pulling data from us as individuals, right? So now I'm a little bit more wary, and this is something that I would caution a lot of people now, is that we need to be a little bit more understanding of how our data is being used, what it's being used for, what is being tracked when we submit our data to these things. So I think we just have to be a little bit more careful, but it can still be, a great tool by bringing visibility to some of the invisible things that women go through with their menstrual cycle or some of the symptoms that they're facing. They can now track this and bring them to their clinician and say like, oh, I really felt, my mood changed in this time, and that aligns with my menstrual cycle. This now brings a lot of data that we once didn't really have, and brings a lot of visibility to some of the more or less talked about issues in women's health.
Fantastic, Carolyn. And what you just said, I saw that Wen was highlighting, also I agree, thumbs up. I really love that idea of information as a social determinant of health, and kind of like quality of information. We're all about, oh, great, let's turn that data into information. But depending on the quality of the data, what information are you getting, whether it's, offering up to people or using then to help them make decisions about themselves. Is that data representative, for example? So, love that. We've already started talking about access. So if we could, visit that again, Natalie, I see you nodding. I feel like we need a whole other half an hour just to even make a dent in the topic of privacy and where's the data going. So I feel like let's leave that for next time, and let's talk a little bit more about access.
Yeah. I mean, digital is absolutely an enabler. But I do think right now that there are bigger things, right? We have bigger challenges regarding access for women, as a result of the Supreme Court overturning Roe versus Wade. You have a lot of things happening right now. I am not an expert in this area, but what I would encourage all of us on the line, whether you're a woman or a man or however you identify, overall contraception, right, is going to be challenged. We have states right now that, are drafting legislation, that would limit birth control or possibly IUDs. You have stigmas that are starting to be associated now, with certain forms of contraception. And you also, probably the most dangerous piece is those states that are then starting to curtail funding to family planning, because now you're talking about, right, limiting contraception probably to the women that need it the most. And so you could end up with a greater socioeconomic, right, divide. I'm speaking very generally, not an expert, but I just feel, everyone has to act. What I had the privilege of growing up with, my daughters now don't. So again,
True that.
Not an expert, but just throwing it out there
Yeah.
to everybody.
Carolyn, we're already at 2, Jerry, sorry. But we started a little bit late. Carolyn, can you want to take us out with any final thoughts? I mean, as someone who, I can only imagine what this is. I can't imagine what it's like to have these decisions impact your practice and impact the way, I know you're not seeing patients right now, but still, the way that you interact with your patients.
I would just say, again, information is so key, and putting that in the hands of everyone, especially now, about their bodies, about their health, right? We have so many misinformed politicians making decisions, creating laws that really affect us on a day-to-day level. And I think women and individuals who, identify as women, we need to be able to push back with knowledge, with data, with our own lived experiences, so that we can create a world that we want to live in, that really, impacts us and our reproductive choices.
Empowerment. Awesome. Thank you so much, both of you, Natalie, Carolyn. Look forward to continuing the conversation. Thanks, everyone.
Thank you.
Thank you so much, Sarah. Carolyn, Natalie, thank you. That was great. It's hard to believe that we are at the end of our 3 hours today. So just a couple of quick reminders. We will be continuing this in our meet and greet. So please join us with that. The last one that I was in, the discussion, it was unstoppable. It was fantastic. So please join that, and you'll get to continue this discussion with speakers and attendees in that post-Zoom event. Just final thank you to our sponsor, Vicert, and as well as our other sponsors. These recordings are available on YouTube afterwards. And the final thank you, last but not least, I have to thank our amazing HITLAB staff that this definitely would not be possible without them. Rachel, Yamina, Raymond, Ansley, Kevin, and Jerry. Thank you all, and see you next month.